Welcome to my YouTube channel. I'm Dr. Emma Kamau. In this video, I'll be talking about 10 milestones in handwashing, infection control, and quality improvement in healthcare. I have two main objectives. One, to discuss a brief history of handwashing contributed by 10 people who were very innovative in a span of 3 centuries between 1546 and 1867. Second, I will talk about antibiotic resistance and the growing problem in the healthcare industry. In 1546, an Italian physician and scientist, Girolamo Fracastro, established invisible seeds on dirty hands and clothes while transmitting infections. Dr. John Burton, a surgeon in England in 1751, observed childbirth fever as a contagious disease. Dr. Alexander Gordon, a chemist and pharmacist, in 1795, also from England, was the first to prove the contagious nature of childbirth sepsis, and he advocated for handwashing with a disinfectant to prevent infection transmission. Dr. Janos, a Hungarian physician in 1809, implemented handwashing guidelines and cleaned medical equipment with camphoric burnt wine. In addition, he also demanded physicians and midwives wash their hands with lime and soap water before and after childbirth to prevent infections in 1814. Dr. Antoine Germain Leblanc, a French chemist and pharmacist, in 1820 practiced handwashing using a disinfectant known as sodium hypochlorite. Dr. Oliver Holmes, an American from Boston, Massachusetts, observed physicians who are transmitting infections from patient to patient because they were not washing their hands. In 1846, Dr. Semmelweis, a Hungarian obstetrician, practiced handwashing using brine. In addition, in 1847, he initiated compulsory handwashing with chlorine at Vienna General Hospital. In 1853, Florence Nightingale organized a team of junior nurses, cadet nuns, and her sister implementing a handwashing procedure at a military hospital during Crimean War. Her handwashing procedures and other patient-centered care practices were so effective and successful that they were implemented in all military hospitals in Britain. In 1867, a British surgeon, Joseph Lister, practiced antiseptic surgery. This is the end of the 10 milestones. And now I would like to turn to another topic and emphasize a few points. All of us want to forget the painful experience we endured during the pandemic. If you do not work in a hospital, you may think that COVID-19 has been eliminated. Unfortunately, there are still people who are contracting COVID-19 and getting admitted in the hospital every day. The risk of getting COVID-19 infection is generally very low when you are vaccinated. However, for those who have not been vaccinated, and if you have weak immunity, children, and the elderly, you are still at a higher risk of contracting flu, pneumonia, and diarrhea infections. Make sure you are using a hand sanitizer or soap and water, and you should also get vaccinated. Another problem you should be aware of is the persistence of the problem of antibiotic resistance. Antibiotic resistance is when a germs or microorganisms transform themselves and changes their genetic makeup becoming stronger and can no longer be treated or cured with the same drugs that were previously effective. This is now another reason why you should use hand washing guidance. These are important scientific guidance from the Centers for Disease Control or from World Health Organization. I'll be presenting another video on hand washing guidance, so be sure to tune in and join me on the next video. Thank you for watching and listening.